Well, welcome back, everybody. This year, the South African AIDS Conference will be held in July in Durban. The 2016 conference will outline the achievements and progress to combat HIV, AIDS and TB since 2000. According to the Department of Health, HIV infections among young women and girls remains unacceptably high. Joining us from our Pretoria studio is Dr Nothemba Simelela. She, of course, is an advisor in the Presidency. Dr Simelela, it's an absolute pleasure to have you on the program. Welcome to Morning Live.
Good morning. Thank you very much, Leanne.
Let's talk about some of the successes and progress that has been made to combat HIV and TB. And let's use 2000 as sort of a benchmark. How are we doing since then?
Well, since 2000, I think the country has done exceptionally well. We must remember that in 2000, when the world congregated in Durban, South Africa did not have a treatment program at that time. There was a lot of complaints, and the international community was pressurizing South Africa to start a treatment program. Since then, we have managed to get over 3 million people on treatment. We have managed to reduce transmission of HIV from mother to child from levels as high as 40% to less than 2% and even 1% in some districts. So we've made incredible progress. Life expectancy has started to increase, and we're seeing more and more people testing and being put on life-saving medication.
Yeah.
So there's a lot of progress. There are still challenges ahead, though.
There certainly are challenges, and we'll address those in a short while. But let's just talk about what you mentioned now is the rollout of this life-saving treatment and these prevention programs, and going from so many different tablets down to just one tablet. I mean, we really, you know, when it comes to the medication and the medicating side of things, I mean, we've made huge strides.
Indeed, we have. And in part of the strides and the successes has also been the reduction of the treatment costs. And we are seeing now that even as more people are getting tested and treated, it's become easier, as you say, to take medication. The number of tablets people have to take, the times and the frequency has also just become simpler. So we really are making progress, and we want to continue to encourage people to take their medication. And these are some of the successes that South Africa will showcase at the upcoming International AIDS Conference in July.
Let's now talk about those challenges, and I imagine the biggest challenge is trying to bring that infection rate down amongst young women and, of course, the girls. It's still too high. What strategy is in place to try and assist?
The rates of infections amongst young women and girls between 15 and 24 years of age continue to be high, as you said, Leanne. We calculate that at least 1,700 new infections a week. So sure. On Friday, there will be a launch of a prevention campaign, but it will be comprehensive because we have seen from the evidence that it is not just about vulnerability. It's also about gender-based violence. It's about the lack of access to skills and education, and it's also a lot around the empowerment of young women. So we will launch this 3-year campaign. It will be launched by the Deputy President, supported by the Minister of Health and many other ministers from the various departments. It will focus on this group, 15 to 24 years of age. We will provide a comprehensive package of services, not just on HIV, but we will also talk about gender-based violence, show and direct young women and girls to where they can get the services, put programs to empower them and to give them skills, and to also deal with the young men and the older men who are part of the transmission cycle of HIV in this country.
Yeah, I mean, that's, just tell me that number again. You were saying 1,700 infections per week in that age group of 15 to 24. of young girls?
Yes.
Unbelievable.
It is extremely surprising.
Yeah.
It's really high.
That's frightening. But now, I know it was earlier this year, if I'm not mistaken, it was our health minister, it was in May this year, he brought about a campaign, I think he was going to spend close on 3 billion rand to try and, I suppose, keep girls in school and also keep the so-called blessers or sugar daddies away from them. How is this going? I mean, is that one of the biggest causes as well, is older men infecting younger girls?
Yes, it is. And it is something that really we have come to understand a bit better, because these young girls, it's not even stable relationships. It's what we call transactional sex. You know, they exchange sex for things like money, gifts, and sometimes for even to pay for whatever they need in school or in college. And we're trying to deal with that by also seeking ways of reaching these men, to explain to them and to provide them with services, ensure that they are circumcised, that if they are positive, that they are on treatment. It's a societal problem. It's not something that can just be dealt with from a health perspective.
Yeah.
I think men and young boys across the country need to realize that for every new infection, we are diminishing the ability of this country to achieve its goal of an AIDS-free generation by 2030.
Yeah. You know,
so we all have to take responsibility.
We hear a lot of talk about male condoms being much more freely available. I mean, you know, it is a fact. I mean, you'll go to many public bathrooms and you'll go to a lot of businesses, and on the side of the road they're handing out condoms. Yet you never really see female condoms around to try and protect yourself if a male is not prepared to use the condom, but to take that responsibility yourself. Has the department looked down this avenue to make female condoms a lot more widely spread?
Yes, indeed. The numbers of female condoms have increased drastically. It's still not at the level that we are providing male condoms. It's a cost issue as well, Leanne.
Yeah.
It's you know, the cost of a male condom are much lower. But there are strategies in place that we need to expand that access. And in order to do that, we must be able to have more resources and more non-traditional outlets, as you say, where these condoms are available in public facilities, also in places like taverns and taxi ranks where people can just have access readily. We are excited that in the schools now there will be an opportunity to promote not just the use of condoms, but also to provide information to empower young women and girls to be able to protect themselves and to increase their chances of not getting HIV.
Yeah. Let's talk about the conference for a little bit. We know it's taking place in July, so that's next month. The theme is Access, Equity, Rights Now. And it just reminds me of this announcement that the minister made earlier as well, that CD4 count is not going to be checked on when it comes to getting antiretrovirals, and that in September everybody will be able to get the treatment now. I mean, I can imagine that follows beautifully into the theme for this year. It
does, because if we look, there are still a lot of people who must be put on treatment who either don't know their status or have not managed to get onto treatment. So the theme really does dovetail into the plans that we've got as a country to, from September, test and provide a treatment. We still have to escalate our ability to reach marginalized populations, people who are in hard-to-reach areas, men who have sex with men, and all the communities that are stigmatized because of their choices, you know, sexuality and gender issues. So there is some way to go. I'm sure you know that not a long time ago we launched a program for sex workers. HIV rates are extremely high amongst that group, and we want to promote access and to ensure that any group that has higher vulnerability is provided access to the services that are available. As the momentum towards the conference speeds up, we will have more information from the Department of Health, from the Minister, and from many other experts and scientists who will promote South Africa, and who will speak about the advances, but also about the challenges, as you mentioned earlier on.
All right, thank you so much for talking to us here on the program. Dr. Nothemba Simelela, she's an advisor in the Presidency, talking to us about this AIDS conference, the South African AIDS conference that's taking place in Durban in July. Thank you very, very much as well. Now,